Bryan Kobel, or as Greg liked to call it, Kobel, because he's saying it wrong, is the CEO of TC Biopharm Holdings. And of course, he joins us here from abroad, tcbiopharm.com. They are publicly traded under the stock symbol TCBP. Bryan, how are you, sir? You and I were talking earlier today about the future of cancer and infectious disease treatment, which you guys are squarely at the tip of the spear, but also the fact that we are now becoming international on television. You're going to be able to see yourself at Bloomberg here very shortly, pal. So you won't be able to...
I'm excited, man, but I'm going to be the only guy over here who knows that they were just playing the Gorillas on your song. So you might want to keep an eye on that.
You won't be able to walk down the street. They're going to clear the streets for you, pal. Hey, can you give an overview for the people who have not heard you before about what TC Biopharm's doing?
Yeah, so TC Biopharm is a cutting-edge, innovative cell therapy company. Our lead product is a donor-derived, off-the-shelf gamma delta T cell. That's the immune cell. It's the first line of response or first line of defense for your system. It's the reason you don't get the flu every day. You don't get cancer every single day. It floats around and it kills these things, and it reacts to a specific phosphoantigen that is only emitted by sick and disease cells. So we use that cell from healthy donors to put it into sick and disease patients in the hundreds of millions to the billions to fight off cancer, antifungal, various other disease states. We have a phase 2b going on in acute myeloid leukemia here in the UK. And we're now branching out and acquiring other cell therapies. Right now we have a CAR NK assets that we're acquiring, as well as another novel CAR construct for gamma deltas and alpha betas in solid tumors. So we're rapidly expanding. We have multiple clinical trials ongoing, and we're looking forward to the next couple of years.
Hey, Bryan, why allogenic gamma deltas? I keep on reading, and I've never thought I'd be reading about this, but every time I interview, I want to try to catch up. Why is it so promising? Like, it seems like it's out of nowhere, and I've never heard of it before. I don't think a lot of people have.
I think there's two reasons. You know, the allogeneic side is it's certainly more complicated than the original sort of cell therapy, which is autologous, meaning the patient comes in, you take their blood, you ship it off somewhere, and you get back a product. It's an easier, more direct way. It doesn't cause things versus graft versus host disease, for example. Allogeneic is more complicated. It's harder to produce. But from our perspective, the reason allogeneic and gamma deltas are really important now, one, gamma deltas are not MHC restricted, meaning they don't cause graft versus host disease. So there's a high degree of safety, high degree of tolerability for patients. We haven't seen any serious adverse events, for example, using our product.
Bryan,
the allogeneic side. Sorry, go ahead.
Sorry, no, I interrupted you. But what's the market view of cell therapy, your cell therapy?
Yeah, it's interesting now. You know, I was talking to somebody earlier. I think biotech markets subsets follow typical, almost FDA processes. Phase 1 is everybody loves you. You're going to solve everything. You're the greatest therapy ever. And you see money pour into these things, right? Mm-hmm. And cell therapy was at that stage several years ago. Everybody was funding cell therapy. So it's a very fragmented market. Phase 2 is people realize, oh, it's not that easy. There are some really difficult problems here and hurdles that need to be cleared. Yeah. So people back off a little bit and the space cools. We're sort of in that phase 2 right now. Some of the major hurdles are development costs. Some of the major hurdles are the economic benefits and the way to create a competitive market. Bluebird's curing sickle cell for $3 million. That's not really a viable market.
Well, Bryan, you and I talked about this before. The 2022, 2023 in biopharm was just horrible. I mean, even if you went to JP Morgan Chase conference this year in January, said, look, you're coming back, but there's not going to be any capital available for 3 months.
I'll say we actually love cell therapy. We think it's the future. We're in the same AstraZeneca, Regeneron. They both stated they believe in cell therapy and they're moving forward. Yeah, we're here to solve those problems, right? And that's why we're buying companies.
Well, that's my next topic. Is that you're buying companies? Yeah. There's an M&A strategy here, and just as a little bit of opportunity to educate here for our audience. When companies like biotech buy other companies, it's what we used to call vertical integration. In other words, you buy the manufacturing company that manufactures the syringes and the drug, and then you've got the drug development company, then you've got the distribution company. What's interesting is in looking at your press releases and looking at what you're talking to, you've got low debt companies, you've got high asset companies, and they fit perfectly in some of this strategy where you end up being an enterprise-wide solution in more than what you started out to be. Talk about that a little bit.
That's exactly what it is. You know, we are a great development team. We have a great process development team. Lauren Bohr is fantastic. Lukash, David, all these guys and women. We have a great manufacturing team. So we know how to make things at a cheap cost in the cell therapy world. We've been doing it for a long time. And we know how to advance rapidly from bench to clinic. So we're taking these companies, and we don't have a myopic view, right? We're saying, look, it's an immune system, not an immune cell. So why would you only be gamma deltas? Why would you believe in only the modality of autologous or allogeneic? Why would you only want a certain modified type? We don't view the world that way. We see it as there's going to be multiple needs for these types of cells and different cells, multiple different modalities, all of those things. So put them under one roof. To your point, be vertically integrated. Test them in combination, test them as monotherapies, test multiple indications, gamma deltas with CAR NKs, great, let's do it. Autologous product, fine, let's do it. You can move down the path and you can solve all these diseases. And when people go to buy other companies, they're going to buy us.
His name is Bryan Kobel, or Kobel, if you want to call him.